Here's a question asking about acute flaccid paralysis. Let's break. Acute flaccid paralysis. So it is said in polio. So we do surveillance. So there are 4 steps of acute flaccid paralysis. One is finding and reporting children. So first we have to find and report children with acute flaccid paralysis. The first links in the surveillance chain are D. Staff in all health facilities from district health centers to large hospitals. They must promptly report every case of acute flaccid paralysis in any child under 15 years of age. In addition, public health staff make regular visits to hospital and rehabilitation centers to search for AFP cases which may have been overlooked or misdiagnosed. The number of AFP cases reported each year is used as an indicator of a country's ability to detect polio. Even in countries where the disease no longer occurs, a country's surveillance system needs to be sensitive enough to detect at least one case of AFP for every 1 lakh children under 15 years, even in the absence of polio. Transporting stool samples for analysis. In the early stages, polio may be difficult to differentiate from other forms of acute flaccid paralysis, such as Guillain-Barré syndrome, transmyelitis, transverse myelitis, or traumatic neuritis. All children with acute flaccid paralysis should be reported and tested for wild polio virus within 48 hours of onset. Even if doctors are confident on clinical grounds that the child does not have polio, to test for polio fecal specimens are analyzed for the presence of polio virus. Because shedding of the virus is variable, 2 specimens taken 24 to 48 hours apart are required. Speed is essential since the highest concentrations of poliovirus in the stools of infected individuals are found during the first 2 weeks after onset of paralysis. Stool specimens have to be sealed in containers and stored immediately inside a refrigerator or packed between frozen ice packs at 4 to 8 degrees Celsius in a cold box, ready for shipment to a laboratory. Undue delays or prolonged exposure to heat on the way to the laboratory may destroy the virus. Specimens should arrive at the laboratory within 72 hours of collection. Third is isolating poliovirus. In a laboratory, virologists begin the task of isolating poliovirus from the stool samples if poliovirus is isolated. The next step is to distinguish between viral and vaccine-related poliovirus. This is necessary because the oral vaccine consists of attenuated live polioviruses and resembles wild virus in the laboratory. If the wild poliovirus is isolated, the virologists identify which of the 2 surviving types of the wild virus is involved. Wild poliovirus type 2 has not been recorded since 1999. Mapping the virus. Once wild poliovirus has been identified, further tests are carried out to determine where the strain may have been originated. Subscribe.